My passion is teaching people how to become and stay healthy naturally. So I decided to quit my practice and dedicate myself to doing just that. Going out and talking with people about what they can do, simple things that they can do that can have a dramatic impact on their life. And with all of my research in the area of breast cancer, I thought the first thing I'm going to do is write a book on all the natural approaches to protecting against and fighting breast cancer, because definitely we have the information out there to end the breast cancer epidemic. No question about it.
Fantastic. So during your journey, what were your opinions about the current paradigm of women waiting to be screened for breast cancer and their options?
So one of the major problems that I had with the recommendations, let's say, from the American Cancer Society that I was then taught to regurgitate, out there, was about, getting mammograms and saying, okay, well, you need to get them every year or every 2 years or whatever. And there's no instructions about anything that you can do to lower your risk. So for me, it was like, so you go in and it's like a game of Russian roulette. What year is it going to get me? And because I had so much work with breast cancer patients, and all I see are breast cancer patients, it's like, your view of the world gets skewed when you're seeing so much of that. And so for me, it was like not a matter of if I was going to get breast cancer, but when I was going to get it is how I was feeling. And I thought, okay, that's not really a good place to be. And to go in and feel like there's nothing you can do and you're playing this game of Russian roulette again, it's like the most disempowering thing. And I thought, I don't want to live my life that way. And so when my mom died of breast cancer, and again, I'm looking at my patients getting younger and younger and younger, and even if they're following what's, said, like, so you get your mammogram and, at young ages, it's not so good because you can't really see through the breast tissue with that. So a lot of times people present with tumors that weren't caught, that way. And then they have to have surgery and maybe mutilating surgery and additional treatments on top of that, even if they have stage 1 disease, with that. It's like, well, that's not how I want to live my life, So that was, another huge impetus where I thought there's got to be a way where we can empower women to do things that can help dramatically lower the risk. And there's so many different things they can do. I mean, the really exciting thing I found when I went through the medical literature is that no matter what they tested, it would cut your risk in half. So you have a terrible diet and lifestyle. You do one thing, you cut your risk in half. You do more than one thing, those things will multiply up together. They don't add up together. So it becomes incredibly simple to dramatically lower your risk of developing this disease. And then it takes the fear away. We don't have to be like so, afraid of this horrible disease. Why is it happening? There's nothing you can do and you're just going to be a victim to it. It's like, no, this is something where we do have tremendous power in dramatically lowering our risk. One of the most exciting and important uses for thermography, I believe, is being able to use it on young women. Mammograms don't work on women usually 40 and under because their breast tissue is too dense. Plus, the other really scary thing about it is that when our breast tissue is younger, it's more sensitive to radiation. And so if you're getting mammograms when you're younger, it's far more damaging. We know that radiation is a contributor to the cause of breast cancer. So it's like, so why do you do a test that uses something that actually causes that disease? Hello. So early on, it's worthless, and people who are 20, 30, 40, and even now we're getting the recommendations, well, maybe you ought to do it every 2 years, Why? Because the statistics don't show that it's actually making such a great impact. So for me, it's a wonderful use for thermography to actually take it into, let's say, college campuses. We introduce it to women when they're young and educate them about, okay, here's something that we can use, completely harmless. It's just a picture of the breast, but it shows us the physiological state. if you have inflammation or not, which is important for every chronic disease, in the body, including diabetes, which we're having, an unbelievable epidemic of. But you can do this and then also educate them early, about what do you need to avoid, what do you need to favor, what impacts it. Because youthful people, they think that they're invincible. And so they can eat, horrible stuff and drink excessively and, they're going to be okay. But like I said, I was, actually working on women in their 20s. So the earlier we can get them, the earlier we can get them involved in their own health. And really it's something that's going to allow them to have a tremendous change in their overall health. And to me, it's like such a great access point to get young people to get interested in their health and start making healthy changes. To me, it's this incredibly useful tool where you can pick women up before they have it, so that eliminates a lot of the fear. You empower them about, hey, these are the things that you need to do in order to reverse that. And then you can show them in like 8 to 12 weeks, we've got reversals, which is incredibly stimulating for people to take care of themselves. And everything that increases the risk of breast cancer or protects against it are the exact same things that decrease your risk of every chronic disease, from Alzheimer's to heart disease to arthritis to, anything. So this is really, the whole system about how to become and stay healthy naturally and have an extraordinary life and, come here to have the joy that we were all meant to have. If someone's diagnosed with cancer, usually they go into a state of shock. We always say you've got post-traumatic stress syndrome, immediately, because we have all these images conjured up of, chemotherapy, losing your hair, all the horrible side effects, and of course worrying about dying. Now, there's so many things that you can do now that can improve your chances of surviving and having an extraordinarily healthy long life that we didn't know about years ago. And I always tell my patients when they say that they go to the oncologist and they're given these statistics, well, if you do this, your chances of surviving are this. If you add this, your chances are this. And I always tell them, okay, so all the statistics that they're using are done on women who were given absolutely no instructions about what to avoid and what to favor. The big message is, do not rely on Western medicine alone. Your best results are really, to me, cancer is it's kind of a choice point in life. So it's like, do you want to be here or do you not? We get to choose. And if you do want to be here, it's the opportunity to do kind of an inventory of your entire life. How are you eating? What are your relationships like? There's so much information about the relationship between breast cancer, diseases in our body, our emotions, and our relationships have a huge impact. So everything. How's your relationship with your spirit or God or whatever belief system that you have? And so it's really this opportunity to kind of revamp your whole life so that it's in alignment with who you are and achieving the best health. And when people take that on, it's like, I've seen people who've had stage 4 cancers where it's metastasized everywhere, and it's gone away. So when people say, oh, is it too late? It's like, no, it's never too late, because I've seen that happen so many different times. Breast cancer, and really every disease, one of the beautiful things in the Ayurvedic system is that it acknowledges that we have imbalances, and there's all these different stages of imbalances that will finally create a disease. If you reverse all those imbalances, you create balance in the body, enhance the body's inner healing intelligence, and things start going away. We didn't have that paradigm in Western medicine, but almost everything's reversible by taking on diet and lifestyle, and particularly emotional issues, too. And when you do that, then it's extraordinary most of the time. As far as the reversals that we can get. You don't want to feel like you're pushed into doing something really fast. It's kind of, you've got time. So take that time to do your research. There's, so many different resources now. And that was one of the reasons I wrote my book, was that, you're out there looking on the internet and doing all this kind of stuff, and it becomes difficult to figure out what exactly you're supposed to do. There's all these controversies with different things. So I had that all in my book, so it would be an easy resource, for people and to kind of clarify that. But, again, this is your journey. I consider it a spiritual journey, really. And so it's like you want to have that time to figure out who are the best people to work with. If you're referred to some doctor that you're not feeling really comfortable with, or they're scaring you, or they're not giving you all the options that you want to do, get a different doctor. I'm so amazed at how people are like, but that's the doctor I said to, I can't change. It's like, no, there's like thousands of them out there. So find somebody that you feel really good, working with, that you trust. You have to, find somebody who's open to doing, nutrition and herbs and lifestyle and everything. There's so much in the medical research right now that if they don't have an awareness of that, that's not the person you want to be working with. I mean, particularly if the statistics show that you got 3 times better outcome if you add those things in. I mean, for me, it's like almost malpractice not to be doing that, because it's in the medical literature. They're not taught that in medical school. They're not taught that in residency, and unfortunately in the meetings. And again, I think it's the pharmaceutical companies that are, and big money, that are running things and not really focusing in on health. It's more about money, So unfortunately, hello, that's how it is. We can be upset about it, or you can just do, kind of operate knowing that that's true, and then really seek out a whole team of people, to help you, and that you feel comfortable with each one of those, people, and that they have, your best interest. You can communicate with them well, you trust them, and so forth. And then, when I work with patients too, it's everybody has a different path. And so I know so many different options about, if you want to go to a clinic, let's say in Tijuana or Germany, I know contacts there. If you want to work with somebody in the United States, if you're, whatever you're comfortable doing, again, this is your own personal journey, then those are the things, that I recommend that people do. And there's no one, right way to do it. You have to do it as your own personal journey. So I always tell people, listen to your own inner healing intelligence, your own guidance, your own intuition, because it'll tell you. I mean, we've been shutting that off, in our culture and everything, but it's like, it's amazing that if you just tap into it. I mean, even when you're going to eat something, you're like, how's that going to digest? I can feel it in my stomach. If I ask myself that, how is that going to digest, or is that going to be good for me, or so forth. So use your own intuition. What's right for you? Who do you want to be with? And let that be your guide. And don't let anybody else tell you, what to do. You find out your options, but, use your own inner healing, guidance.
And then just real quickly, I was going to ask you your thoughts about the BRCA gene. Like, what can women do besides the
mastectomies? Sure, we'll talk about that. Okay, so it's really interesting when I ask audiences how many people think your genetics has a major impact on whether you develop breast cancer or not. Hands will come up. Well, genetics means practically nothing. So usually they go, well, it runs in my family. Half the time it's because you all ate the same, you had the same lifestyle, and so that's why, it's higher in your family. Now there is a genetic form called the BRCA gene mutation 1 and 2. And we used to think that, our DNA was just this static molecule, kind of the information for our anatomy and physiology, and that it didn't change. Well, since we mapped out the human genome, there's been all sorts of new information that we've gotten as far as the fact that everything affects our DNA and how it expresses itself. So every food that we eat, it gets broken down into these little chemicals that will actually hook onto the DNA and turn certain genes on and turn certain genes off. So there's a huge area of research right now. In fact, if you go through, there's a site on the internet called PubMed, M-E-D, where you can put in any search term, and there's like thousands and thousands, millions of abstracts that'll come up on it, so you can do those searches. But in the last several years, virtually everything they test for, they're looking at, well, what gene does it turn on? What gene does it turn off? It's called epigenetics is kind of, the new area. So even the thoughts that we think will produce chemicals that'll hook onto our DNA. So they'll find that women who are depressed have 4 times, the incidence of breast cancer. I'm like, boy, that adds to your depression, right? Or if you've had a huge stress that's occurred in your life, then in the ensuing next 5 years, there's a 12 times higher incidence of developing breast cancer. So we know that everything affects us. Now, for people who have the BRCA1 gene mutation, they say that the normal statistics are that about 80% of them will develop breast cancer by age 80. So there's been this recommendation, well, you should just cut off your breasts then, because your risk is so high. Now, the interesting thing is that when they go back, in the looking at the family history, they can say, wow, back in 1940s or 1930s, 80% of people did not get breast cancer. It was only 40% or 30%. It's like, why would that be? Well, because if you have that genetic mutation, you can alter your risk based on your diet, lifestyle, herbs, thoughts, emotions, and everything. The history of medicine is really kind of interesting because long ago and far away in the land of India and China, they wouldn't even pay their physician if they were sick, right? You got paid if you were well. So it was a paradigm where the patient was always working with the physician on creating the best health that we could. Somehow, during the early 1900s, we'll say, particularly in this country, it became this very patriarchal kind of relationship where, the doctor was God, the doctor knows all, the doctor will tell you like a parent, you do this, and you have to be this completely disempowered, childlike, person that, that has absolutely no say-so over your health. That doesn't work very well, and really the ancient cultures knew much better as far as allowing each individual to work with the physician, doing things about understanding their own individual, health and what they, need to do to become as healthy as they possibly can. So my message to women, particularly when we talk about breast cancer, is that you have extraordinary power in lowering your risk of this disease, which is all too prevalent in our culture, and that there's so many simple things that you can do. So you do one thing. Again, one thing, you can cut your risk in half. If you do more than one thing, those things will multiply up together. They don't add up together. So it becomes incredibly simple to dramatically lower your risk. And the side benefit is that you feel better and better and better. So it's simple. It's not complex. And there's great information out there, which you can find in my book, Waking the Warrior Goddess, Your Internal Healing Intelligence. Or on my website, which is drchristinehorner.com.